you need to be open to learning from the men and from the changing, I guess, climate and cultures that we are regularly involved with. I can't stress enough how important community-based relationships are, and community engagement and consumer engagement, not necessarily just for program design, but also sustainability. As we know around the world, not just in Australia or Canada, money's becoming less and less available to run programs. The governments are strapped basically everywhere now with everything that's going on. So we really need to think of innovative, cost-effective ways to engage men. And I think that's what Hat Trick is. We are able to do this in conjunction with community partners that have the capacity to not only advocate, help recruit men, but also help deliver the program. And how we've set it up in that, we want the men to be able to deliver it to the men, really help, hopefully, to continue running a cost-effective program that's sustainable over the long period of time. And right now, very exciting things happening here. We have taken Hat Trick, and we have done some very, very informative work in how we can transition Hat Trick Canada to Hat Trick Australia. And it's going well, and we're looking at trialing it very soon, just trying to find others to help support us. But I guess at the end of the day too, one thing that I think we've done really, really well is that step-by-step process. We started off, everyone can have a great idea and just run something, but we really made sure that we understood what was going on. We looked at the evidence that was currently out there. The next step was the co-design and consultation. We've formally tested it. We've refined it. We've refined it again and again, with more consultation throughout the whole way from stakeholders as well as men and researchers. And so that step-by-step process from, building to delivery and outcome, I think we've done really, really well, and we continue to do that here. Would you agree, Paul, with some of that?
Yeah, absolutely. As Christina said, we're constantly learning and growing our understanding, and that helps design better programs. So I think one of the really important pieces to keep in mind for someone that is getting into this area is that it's a very fine balance between playing off of traditional masculine stereotypes and not perpetuating those in negative ways, because oftentimes it's cited that things like men's strength and stoicism and things like this counteract their health. And if we try to engage men by using language like harden up and toughen up and these sorts of things, we're just perpetuating those negative male stereotypes. So I think truly progressive next step interventions are going to be transformative in ways that they still engage men, but also shift perspectives and maybe start framing those masculinities in ways that are more healthful and that support health. And there's ways to do that. Instead of changing men completely and trying to get them to do things differently, it's meeting them where they're at and framing it in a way that is helpful for them in ways that they can continue into the future.
And on that note too, I think Paul's touched on something really important, is that flexibility and the idea of real world. As academics, as researchers, it's always ingrained in us, randomized control trials are the gold standard, controlled settings. That's not what happens in the real world. And men are like anyone else in the real world, and being flexible and understanding, and this is advice for, future researchers in the area, is understanding things will change, and they'll change very quickly, and how men react to things is going to be very different. And you have to be, I guess, flexible and comfortable in yourself to understand that that's the real world. And that's what we want to work with. We want to work with the real world, because that's how we get men to get involved and stay involved. And I'm guilty of this too. In the past, I think researchers, we still focus so much on these controlled trials, and we don't actually, and this is where the struggle is to get those trials into real world practice. So I think another thing that, you know, we do really well is that transition. And it's tough because we're fighting against a like historical traditional way of how academia goes. So I think though that at the end we're gonna win. We're gonna get through, and the idea of more relaxed pragmatic trials are going to be more helpful and beneficial in the future than what we've seen in the past.